How is breathing affecting your health? Today, people suffer from the ramifications of breathing issues, yet we struggle to find answers and how we can help ourselves to breathe better and feel better. Today, to talk about the science of breathing is Dr. Rosalba Courtney. Rosalba, thank you for joining me today.
Yeah, thank you, Stephen.
Rosalba, breathing is such a fascinating and very topical issue at the moment. And but you've been doing this for quite a long time. And I think there's a lot of confusion out there in the community as to what proper breathing is, which we'll dive into. But I thought for those that weren't familiar with your work, tell us a little bit about how you started as a practitioner, to start to look into and then going down the road to doing a PhD in breathing.
Well, I trained I trained in the 1970s, if you can believe it. Somebody asked me the other day, how long have you been in practice? And I said, graduated in 1978. So, so I trained as a naturopath, osteopath. I did acupuncture, Chinese herbal medicine. And I was always, in those days, you sort of could, So it took me like kind of 10 years to get all of those under my belt. And then working with patients, I was just always interested in finding, the best way to help them. And I had a bunch of patients who had strange breathing symptoms or who had asthma. So I started looking at ways to help their breathing, looking at breathing exercises and so on. And that kind of led me to the Buteyko method, which was, came to Australia in the early 1990s. And so I got involved with Buteyko and I became chairperson of the association and we went to Russia, met Buteyko, and I wrote the first training courses and so on. And the more deeply I got into that, especially as I was training people, and I met some great people who were students in the class, but they taught me as much as I taught them. And, I started to realize that actually there's more to it. This breathing thing, people get better using different sorts of breathing techniques. And people have been using breathing to heal from the beginning of time. You've got records in the Indus Valley, going back thousands of years of people using breathing to heal. And in every language of the world, the word for breath is the same as the word for spirit, essence, life essence, and so on. So there's that side of it. And, there've just been lots of fabulous breathing therapies. So the more deeply I got into it, the more I realized I don't know anything and I can't really put myself out there as a teacher of this stuff. So I went back and did a PhD. So I did a PhD. I started in 2002, finished in 2011 and ended up with, my current work, which is just, I call it integrative breathing therapy. And it's really about, I sort of developed models, for work, because I wanted to work clinically in a kind of a professional way with the breath, because it seemed to me that there was the art of breathing, then there was the science of breathing, and sometimes they didn't quite match up, because in the research literature, there was a lot about breathing. And then the art of breathing, sometimes, so much contradiction in there. So I came up with a kind of a protocol for assessing breathing and then individualizing breathing therapy so that people could get the therapy that was most likely to help them. And that's it. Okay, go on.
Yeah, that's a great kind of overview, and especially to the depth of, when you really look at through the literature, as you mentioned about, breathing, it is so widespread, isn't it? And, sometimes disparate and there's lots of different, places that this information is sitting, and it really takes someone to kind of, build bridges, to start to understand, well, how do we understand what's happening in the body? And then, how do we change this in a patient? So, it's a real credit to you, going to do all this work and for so long. Can you describe a little bit about that problem point? I imagine when you started your PhD, you had all this literature sitting in front of you. What were you noticing that was, being published? And then what was the gap that you tried to build out in terms of, how we build this model for people to breathe better?
Well, I guess my thesis was called Dysfunctional Breathing, its Parameters, Measurement, and Clinical Relevance. So that's what I set out to investigate. So dysfunctional breathing, so before the 1990s, or before, say, the mid-80s, people had been writing about breathing dysfunction as this disruptor of health, going back to the Civil War and Da Costa, you know who I'm talking about? The surgeon who was with the Civil War soldiers, noticing that when they fell apart, their breathing fell apart. And when their breathing fell apart, their heart rhythms were all over the place. They couldn't function. And pretty much after every war, people were noticing that there was this thing. And they called it soldier's heart, effort syndrome, and hyperventilation syndrome. And so hyperventilation syndrome was a thing until, the 90s, early 90s. And the idea was that people with dysregulated breathing had hyperventilation. That was their problem. And then a bunch of studies started noticing that, wait a minute, people who with hyperventilation syndrome, they don't necessarily have low carbon dioxide. What's going on? And so, there was one research study where they had people people who were diagnosed as having hyperventilation syndrome. Then they had people who were just normal. Then they had both groups hyperventilating, and then hyperventilating an isocapnic gas mixture, meaning that they kept their CO2 the same. And they found that symptom production didn't necessarily correlate, especially in the hyperventilation syndrome group. The symptoms didn't necessarily correlate with the drop of CO2. So then they went, wait a minute, symptom formation is more complex than this. Dysfunctional breathing is more complex than this. What is it? So in the 1990s, pretty much all the scientists, the respiratory psychophysiologists who were researching, hyperventilation syndrome and dysfunctional breathing, well, actually, they were just calling it hyperventilation syndrome. They went, oh, we've got to rethink this. So pretty much for a decade, hardly anyone would touch carbon dioxide. The hyperventilation syndrome stopped being a diagnosis. And I was teaching the Buteyko method, which is entirely based on this idea that hyperventilation is the scourge of modern man, and that, we have to do everything to reduce our breathing, raise our CO2, and then it'll heal everything. And so this is the big conflict, for me. It's actually the big thing that made me go and do the PhD, the CO2 question. And so what I found, the model that I developed of dysfunctional breathing is that dysfunctional breathing has three key dimensions. One is biochemical, which is hyperventilation and CO2. One is neurophysiological, to do with the brain and rhythms and oscillations and perception and the autonomic nervous system. It may or may not be related to CO2, okay? And then the third dimension is the biomechanical, which is the structural, which is your work, Steve, which is all about the sufficiency of the airway, the ability of breathing muscles to function in a coordinated and appropriate way, to give appropriate feedback back to the brain. And so they're the three key dimensions: biochemical, biomechanical, and psychophysiological. And so so there you go. I'll stop because I think that's your question.
Yeah, I think that really sums up well the kind of the background as to the problem point that you had to kind of bring together, and why it took so long as well, because it is a very complex area, and it also a very complex problem for people as well. So I thought because obviously in the dental practice we see these symptoms and they are difficult to describe. So your work really starts to help build in diagnosis capabilities, where we can start to see, well, okay, why is this breathing pattern coming in? We look things very structurally, but there are obviously other things going on too.
Yeah,
I thought we might dive a little bit into what people are experiencing and what you've noticed in your patients in terms of what are people presenting. You mentioned asthma, and asthma is a very common condition now in young children, and especially children with developing dentitions. We
Yeah.
see asthma very often in this age group. What would
Yeah.
you say is a typical presentation, in this age group of breathing dysfunction, and where would you tie that into your model of what is happening?
Are we talking about children now? Children?
Yeah, so I thought we'd start with
Yeah.
children. Yeah.
Okay. So the children I see all need to see dentists usually. You know? So children that I see will come because they have asthma, right? Or they'll come because of chronic mouth breathing. They're often brought to me because they have behavioral and sleep issues. And also some of the children, just the parents notice they have dysfunctional breathing. So the child just is unhappy with their breathing. They're sighing, they're just not breathing in this way that looks good. And the parents go, well, what's wrong with my child's breathing? And then my diagnosis with children, it's a bit different to adults, but with children, children can get dysfunctional breathing and stress-related breathing disorders just as much, well, not just as much as adults, but they do get them, and breathing is very much affected by stress. And stress, as is just where something has overwhelmed the body's adaptive capacity. It's not just having bad thoughts, and being neurotic. It can be like a physical thing. So just imagine a child is born and there's something's threatening its airway. They can't breathe. So there's something in the neonatal period, or perhaps they're developing some obstruction to breathing. The brain interprets that as stress. It's a stress, or something is a threat to life. It's overwhelming the little tiny baby's capacity. So that can really change fundamental, it's called long-term facilitation of breathing control. Something changes in the brain. And so the child then is always feeling like they're not quite getting enough breath because all their chemoreceptors and their whole breathing system, it's like turned on for wanting too much air. And so they can start mouth breathing at that point or develop an abnormal breathing pattern. And sometimes, they've got an obstruction. And so they might have a tongue tie or something, or the palate is narrow and the airway is small. And you put all of those things together and you get a child with quite a disturbed breathing pattern. But the big thing is often their mouth breathing at that point. But they're also breathing weirdly. They'll have high thoracic vertical breathing pattern. And the issue is it's often got three dimensions. It's got this dimension of the mouth breathing, the breathing pattern, often the kind of wiring, the neural wiring for breathing is just a bit off. And the child often they've got some problem with the perception of their breath. So they're either completely disconnected from breathing, where they don't know how they're breathing. They've kind of checked out. So they've got poor breathing perception and poor body perception. So they're not very in tune or embodied, with the breath or other body sensations. And then you've got the hyper perceiving child, where they're just always like, oh, I'm choking, I can't breathe. And they'll have, this sort of over perception of their breathing. The most dangerous is the underperceivers, because they're the ones that can have the life-threatening asthma. They're a sort of a subcategory of asthmatic children who really don't perceive with their body or their breath.
It's interesting, yeah, because we see that quite, especially the disconnection. The complete being completely unaware of a breathing pattern, and with the very cursory questions in the dental chair, you can see that. That there's these two categories of patients: the people that are very aware that they think they have a problem, but they can't ascertain as to what that is. And then there's the people there that just have absolutely no idea that there would even be an issue at all. So it's interesting. I think you probably see this a lot better than other people, but the mechanical factors of breathing. So for a parent looking at a child, say we're thinking about parents being more conscious about how their child is breathing. How would you tell them to assess their physical posture and the thoracic movements of breathing to start to think about whether their children are breathing efficiently, which we'll talk about more later. But just some of the signs in the body.
Yeah. Well, mouth breathing, of course, is the big one. But then in breathing pattern, what you look for is excessive sighing, yawning, excessive, that kind of thing in breathing. So if you see, a couple of those a minute, that's quite dysregulated rhythm or pattern of breathing. So you look for that. Then you also look for, do you see that child, do you see shoulder movement? Do you see upper vertical movement? Does your child seem to get too breathless too easily with sport? Do they have trouble blowing their nose? If they can't blow, often the breathing pattern's a little off. And the other thing you might do is lay them down on their back and see if they can breathe into their belly. And if they can't breathe into their belly and they've lost that connection, if they can't breathe into their belly sitting up. And some kids will respond quite well to just a little training. Some kids, it takes weeks, to try and reset that connection.
And so the thoracic signs, you see that there's you made a shoulder movement kids move their shoulders and upper chest movement. Is that
you see a vertical dominance in the breath. So you see the breath, which is normal. It's normal to breathe like that sometimes, but to breathe like that at rest is what's abnormal.
So instead of an expansive
it's the relaxed, what's called the relaxed configuration of breathing, which is how you should breathe at rest. Should be dominant, widen in and out. Widen as you breathe in, narrow as you breathe out. Vertical pattern is lengthen as you breathe in. And so a lot of what I do with kids is like just training them to reverse those patterns. So we talk about slinky breathing, breathing like a slinky and changing that pattern and getting that breath. Yeah.
So lower up and down movement more in getting this idea of expansion.
Yeah, breathing wide, And we work with sound. We do ma, ah, ha breathing and just try and get the sense of widening, with the breath. And you breathe out and so on.
It's so interesting because you see these muscle patterns and so forth, but then the application is very and it's very detailed, isn't it? Obviously, your work and the problems that in the dental chair we see is that this affects the growth and development of the jaw, and this is something that you've interfaced quite well with during your career, and it's something that people are really starting to to kind of wake up to. How would you say, there's a question here from Corinda. So for kids that have a small crowded mouth, would you say that breathing therapy is beneficial if crowded teeth, a small palate, cannot be remedied at present time? Because we find this problem in the dental practice where we have a very small mouth, and sometimes, if it's a young child, you can see there's a breathing issue or there is snoring. What would you say in terms of when there's a structural problem, how we interface this, guiding a child to better breathing when there's an architectural issue?
Yeah, that's right. You know how difficult it is with children sometimes. They come and see you and you can't do things because they're wriggling all over the place, or that you can't quite get an appliance that will be appropriate for their age. And it's a challenge, but how important it is to do things early. And so it's just always a matter of finding what can you do at this stage, and with a baby, it just might be things like, if there are a whole lot of age appropriate things that you need to do. And with a very small baby, you might just do things like cuddle them close, work with your own breathing, relax, maybe use, a humming, like what mothers have done since the beginning of time, just hum and sing to them and just try and entrain their breathing with yours, soothe them with your breath, and then close their mouth, keep closing their mouth. And then as they start to get older, you might do things like teaching them about swallowing, getting them playing games, swallowing through a straw, sucking through their teeth so their tongue starts to move properly. Some manual therapy, releasing the cranial base, working on these muscles underneath the tongue. So, in a nutshell, like, yes, the answer is yes. but it's not like, oh, do this breathing exercise with your child. It's a really, breath is so vast. You know, breathing is interacting with every system in the body. And the professional approach to being a breathing therapist is not just having a breathing technique that you do, boom, and you give it to this person, that person, that person, that person. Do you know, it's about, you've got a person in front of you. There are things that have made their breathing become disturbed, you know, and those things are going to keep disturbing the breathing until you address them. That might be structural, or it might be the nervous system, or it might be the gut, it might be reflux, you know, it might be vitamin D deficiency. It's like, as a professional, you look at the causes, you work on those, and you work in an interdisciplinary manner. And and then you work with the breath where you can, you know, where you can, and then you support that by, you know, looking at the other surrounding things.
Now you've really highlighted well, you know, the problem is it's a difficult, you know, behavior to change in people. And I think parents can sometimes feel a little bit hopeless in that sense that, you know, if they've kind of been awoken to this whole area and they see these issues in their child, they struggle with the steps as to fix it. But, you know, you highlight well, actually, I like that technique of breathing with a child, because a child will intuitively, you know, take on a pattern from a parent, and it probably leads us on to talking to adulthood breathing dysfunction. But yeah, I think that would be because, you know, small things, you know, affect a child, and you know, kids take on, they're like a sponge, aren't they? So I think small things like that for parents would really, you know, start to at least, and also to help them feel better about, you know, and I like that technique, yeah, of breathing with the child. That's and those kind of things that we're doing day to day is definitely something we try to interface in a practice, but really what you do at home is ultimately what will change the behavior. So I thought we'd go on a little bit to adults, what we see, because this is, as you mentioned, this is an area that has been quite, it's been quite misunderstood for decades now, and that you've been piecing together the story. What are we seeing in, common symptoms of breathing dysfunction in adults? And obviously they're widespread, but, let's take a female in their, early 30s to mid 30s who is, perhaps not sleeping that well, maybe a little bit, anxious, or, seeing their physician maybe for depression. What do you see in terms of breathing physiology that is, connecting to these issues in the body?
Symptoms or physiology? Symptoms.
Let's talk symptoms first, yes, so that we can kind of, and then we'll talk physiology
Okay.
after, yeah.
Yeah. There are questionnaires, that I give for the professionals out there who might want to know. There's a questionnaire called the Nijmegen questionnaire, and that's been around for a really long time. It's been 30 years. It's been used originally for dysfunctional breathing, for hyperventilation syndrome, but now it's used for dysfunctional breathing, this new thing we've got, broader than hyperventilation. The Nijmegen questionnaire, and the Nijmegen questionnaire, it's got 4 dimensions. One is breathing, and so the breathing symptoms are faster. They're noticing faster, deeper breathing, noticing that their breathing feels tight. They can't expand their lungs as much as they want. They have this feeling of, just difficulty, insufficiency of the breath. The Nijmegen questionnaire only has 4 breathing symptoms. The other symptoms are things like tingling, numbness. If you've got tingling and numbness, you've got bad breathing. You've got hyperventilation. That's just probably the worst form of dysfunctional breathing, where you're getting tingling, perioral numbness, tingling. And then maybe dizziness is another symptom. Abdominal bloating sometimes can be a symptom, although, of course, that can be connected to gut things as well. So and palpitations. So they're the symptoms of the Nijmegen questionnaire. They don't diagnose it, but all together, when you've got a score above 20 on this questionnaire, then it goes, dysfunctional breathing. So in my research, I developed and validated a different questionnaire, which is called the Self-Evaluation of Breathing Questionnaire, or the SEBQ. And these are all available on the internet. And Both of them are in many languages, you know. Even my questionnaire, which is much newer, has been translated into Russian and Japanese and some other languages. And the SEBQ, it's just when you've got a lot of breathing symptoms, you know, when you've got a lot of things like, oh, I'm breathing through my mouth, my breathing is irregular, I'm sighing, I'm yawning. Big symptom that's a giveaway for me is when people say, I can't get a deep or satisfying breath. I can't get a deep or satisfying breath. That's a big one. And the SEBQ has things like, you know, my breathing is irregular, I'm sighing and yawning, and so on. And that's a 17-item questionnaire. Best to go find it, you know, on the internet.
And symptoms that are very, very common. So in terms of, I'm just trying to because, you know, we see this so often in the dental practice now, and you know, these questionnaires are very useful, and it's especially when we start to connect them to physiology. So look, I feel that well, the discussion on breathing now has shifted to hyperventilation, right, with sleep apnea and so forth. But what you're describing is that, so there's a lot of people with hyperventilation that are undiagnosed. So
Yes.
can you help people to understand what's happening in the body with hyperventilation? Because this is,
sure.
Yeah, because I think people are, you know, obviously a little bit more aware of sleep apnea and so forth, which we'll talk a little bit about after.
Yeah.
But this hyperventilation, what's happening in a person's body when they're breathing too much?
Okay, hyperventilation. So there's hyper, which means too much, and hypo, which is too little. So it's all relative, isn't it? Like a lot of people with first of all, hyper and hypoventilation are biochemical descriptors. They don't mean breathing too fast. They don't mean breathing too shallow. You know, they mean hyper means breathing in excess of metabolic requirements. So there's a depletion of CO2. Hypoventilation is not breathing enough. So you're not blowing off the CO2. And it's more about CO2 than oxygen, because oxygen is, body's very good at maintaining its oxygen levels. You know, it's got heaps of mechanisms because it's such a survival thing. But CO2, the body's pretty good at getting rid of it. So that's why people, it's relatively common for people to have hyperventilation. 1 in 10, they reckon, you know, has hyper. And so the thing that makes you hyperventilate, there's a bunch of things, but, you know, stress, anxiety, having had a bit of airway obstruction or airway inflammation, where the brain, the brain goes, oh, I got a problem here, I got to breathe more. And so survival mechanism, you start to breathe a bit more. And some people kind of breathe more and then breathe less, breathe more and then breathe less. So they get a dysfunctional breathing where the CO2 might be normal on average, but their breathing is kind of erratic and all over the place. Okay. So that's your erratic breathers. They're your breathing pattern disorder people. They're not necessarily hyperventilators. Okay, so that's that category. And then there's your hypoventilators. And you know what? Some people with severe depression, or some people who have just kind of gone over, you know, they've gone into that sort of freeze response in their nervous system from trauma or whatever, they can be hypoventilators. And their CO2 can be high. And also people with obstruction, you know, the children with the worst, largest adenoids and tonsils, they can have high CO2. The people with sleep apnea who are, you know, it's called obesity hypoventilation syndrome of sleep apnea. It's your classic Pickwickian syndrome, you know, your fat old guy falling asleep all the time with a big thick neck and so on. That group is often got high CO2. They're hypoventilators. And you don't know till you measure. So if someone says, oh, everyone who's a mouth breather is hyperventilating, no. Everyone who has sleep apnea is hyperventilating, no. But, you know, you hear this in the breathing therapy world and it makes us look foolish. We've got to stop saying that because it can be both or neither, you know.
Well, exactly, because you're describing such a diagnostic spectrum there that that present in so many different ways. How would you look? How does someone so we've started to talk about the overweight male, who is the more typical person that is being diagnosed of a breathing issue today. How would you say that they get to this diagnosis of sleep apnea? How does the body move to this dysfunction? Because does it start with hyperventilation, and how does the brainstem move on to this road of not being able to manage breathing during sleep and so forth? And obviously there's many different inputs, but do you think there's a road there?
I think there are many roads. Do you know, I don't think it's one road. I think it can be many roads. But I think, okay, look, it may have started in utero, do you know, with the mother's health and the microbiome of the mother, and then the interuterine environment. And, you see babies born with a narrow palate, do you know, don't you, Steve? They're born with a narrow palate, and the tongue is down. It's not up. It's not developing the palate. Which comes first? You don't know, but it can start in the interuterine environment. And so it can be this whole sort of structural road, can be a structural road, like that, and then there might be a metabolic road. So it could have to do with the mitochondria and, the fact that people are developing insulin resistance, they're developing insulin resistance and metabolic syndrome. And, it cannot maybe not start off as a breathing airway issue. It can really start off with a metabolic issue, gut microbiome, high levels of inflammation, high carbohydrate, high sugar diet. And then, they get overweight, and then the breathing issue comes next, So then there'd be everything in between. Then there can be the stress pathway, where some people end up with instability of breathing control, especially at night. And that instability of breathing control sort of triggers the metabolic problem. They start to hyperventilate at night, and maybe they've got panic disorder and anxiety in the day. And then, it starts to affect the sleep. They don't go into deep sleep. They're constantly rousing. And then the autonomic nervous system goes off. And then you've got, someone who becomes inflamed. And then out of that, you start to, not sleeping well causes a dysregulation of the glycemic control system. And then you start to put on, you know what I mean? Like, it can be many pathways.
No, absolutely, and obviously, all the development has a huge plays a huge role in it. And I talk to adult patients, in this situation almost daily now, and it really is, the conversations are going this way where we're pinning back, to really try and give them the picture that there's so many different contributors to their current state of health. And in order to fix this, we need to put all these different things into place, and everything won't happen at once. There's Rosalba, one thing that many people are being faced now are CPAP machines, and obviously they've received a diagnosis of sleep apnea. What would you say in terms of the application of CPAP machines is in terms of being a breathing instructor? What would your advice to someone that has been given the recommendation of a CPAP machine, or a family member?
I know a lot of people end up not using them. I think sometimes they're really indicated. Someone who's got a really high AHI, apnea hypopnea index, and their oxygen's dropping really low, I think sometimes they just need to be on that CPAP machine for a while, but they should be working on other aspects of their health, their metabolic health, their exercise, their daytime breathing habits. And then particularly overweight people, as they start to lose weight, they might be able to wean off it. I think that there are a bunch of people where the CPAP is not the most appropriate thing, where the main issue with them is actually a structural issue or an instability of breathing control and a poor breathing pattern. And so someone with sleep apnea, usually they just get given two things: mandibular advancement or CPAP. And, sometimes they don't solve the problem. So there's this other side, the metabolic side and the breathing side. And when people take care of that as well, they expect much better. They should expect much better results. But some people do really well with mandibular advancement too. But, and some people really just want an easy fix. And they don't really want to put the work in, or they don't have the confidence, they just can't structure and organize their lives sufficiently, to do breathing exercises and exercise and do the other side.
I think that's a great point, because when I'm speaking to patients about this, I'm always trying to gauge where their internal motivation is coming from, and are they, because there are people looking for a quick fix. You're always trying to instill them that breathing is a journey, but there are some people that you're right that they're just not in the space in their life to be able to kind of to put the work in to really change this fundamental physiology in their body, and and they need something like like a machine or a splint. So I think that's a great point. That there's this, and then and they say, look, maybe in a year or so I'll kind of come to this, and there's benefits too.
Exactly. And sometimes people are just feeling so bad. That it's really hard to organize themselves because they're just barely getting through the day. And so then, but I don't know, I try and encourage people to do simple things. Just, okay, what can you do? I've got someone I'm working with at the moment. He said to me, look, you can only teach me 3 things. I can't take in any more. If you give me any more than 3 simple things, I just won't do it. Just give me simple things. And then every week comes back and says, okay, I haven't done my exercise. I say, okay, no worries. Let's sit down, do them together. If you keep paying me, you can sit with me every week. I'll take you through the exercises. And as you start feeling better, perhaps you'll get on board and do it yourself. I've stopped being judgmental because, it's tough for people. And sometimes it's confidence. There's this term they call health self-efficacy. And it's almost like when you start to get on top of it, you get a charge, you feel good. Wow, look at this. I'm making myself feel better. But if you try things and they fail, and you try and you can't keep it together, you really lose confidence. And sometimes the work of a therapist is to support people, hold their hand as they build that confidence.
Yeah, and I think you're right too. Yeah, that there is that little watershed moment sometimes where you make a breakthrough, and then they feel a lot better. And just personally, I've found that doing this journey myself, which I've probably been on for about 5 years now, I've found that the quality of sleep, the quality of the way my body feels, during exercise, and the control I have, even in the clinic, trying to control my breathing in the clinic, it really does have a day-to-day benefit that I just can't quantify now. There's nothing that I would say is more valuable than me thinking about my breathing. And, so I try and, you try and instill these things, obviously, but, people are in, it's a difficult problem as well. So, and it's always a journey.
It is a journey. So how do you work with your breathing on a day-to-day basis? What are you doing during the day with your breath?
Day to day. So at the moment, I'm really working on tongue posture, and especially because, I spend a lot of my time in the dental chair. So tongue, and especially the posterior seal.
Yeah.
So that's something that's
back of your tongue. Yep.
Yeah. So the back of it. Exactly. Yeah. So that's something that I've found that has helped a lot, because connecting the posture into how it's my reminder, because I find when I'm focusing on, if we're doing a procedure or something, that your mind falls off. And then I find my shoulders slump, my head comes forward, my tongue goes down. And then I realize then that's when the mouth breathing can start. So once so I start to focus, and then so all those things fall out. So I've found that trying to center on that posterior tongue seal helps to keep all that in check, and then everything stays in tune. And it's difficult, especially during a procedure, it's hard. But
and each of those, some of those dental procedures are nerve-wracking. I would think. When I'm in the dental chair, I often think, "Oh my God, you're so brave." doing what you're doing.
I mean, that's right. It's life, like life is nerve. So, but breathing is just such a great way to keep that controlled. And, any high stress situation is absolutely, going to be, centered around or more kind of calm if we can control our breathing. So look, there's this problem point, in adults who are really motivated. I feel we're kind of at the area that, there's adults there's enough education out there for people to change their breathing. It's difficult if they have architectural problems. In kids, there's a lot of parents out there that are asking me, what can we do to stop mouth breathing? And so Grant asked, how can I stop my daughter from mouth breathing? Are there exercises to improve lung function in kids? So stepping into, obviously, there's only so many things you can answer, Rosalba. How would you, where particularly mouth breathing is obviously a problem in the child, how would you approach that? And, what kind of tips would you give, in terms of stopping the habit?
You need to understand if the child can do it or not. Some kids can't, They need to go and see an ENT and get their tonsils and adenoids checked. You might harangue them to close their mouth, and they just can't. And when they close their mouth, they'll just get antsy, they'll jump about, their behavior will get worse. So you need to really have your child checked, But it's, a lot of kids can be encouraged to close their lips. So it just starts by saying, okay, honey, close your mouth. You might even want to have a quiet time where you sit with your child and you say, okay, we're going to have nose breathing quiet time. And you sit and you make it a comforting, nurturing, relaxed, rewarding time, and you sit with your child and you have them nose breathe. And then you can play games, and you play games and you say, okay, in this game we're not allowed to open our mouth, and you can just work with increasingly increased levels of activity and keep it nasal breathing. So you just have to be creative as a parent, work things out, how you would do that. Ball games, dancing games, Simon Says, I do a bunch of stuff like that. So quiet with the little kids, sometimes we only get as far as doing nose breathing quiet time and active nasal breathing time. So, that's a good start for you. That's as far as I'm going to go.
Yeah, obviously but I mean, basically what you're saying there is you need to, create practice and create mindfulness in the household in terms of how, the child begins to realize the importance. And the habits in the adult as well, because if a child sees their mum and dad mouth breathing, they think it's normal. And
totally, yeah. Often there's no awareness in a child, So you start by building the awareness and making it a thing that you reward, Oh, that's so good. You look so great breathing through your nose. How'd you manage that? I've got two children, and one is 28 and the other is 36. And I've got pictures of my, 28-year-old as a baby in nappies, and we're doing nose breathing exercises with him in nappies. And he grew up to have a great face, He had a palate expander for 6 months or something. And then the dentist was just amazed. He said, wow, he's just kept on expanding. He's just doing so great. And I went, yep, nasal breathing, And so we started really little, but I remember my children, we always talked about, nasal breathing, and it's just sort of a thing we talked about in the household. And it sort of got embarrassing really, because we'd go for walks, up to the lighthouse here at Palm Beach, and I'd go with my children and they'd see someone mouth breathing and they say, Mummy, did you see that mouth breathe up very loudly so that everyone could hear? And I go, it's okay. No big deal.
Yeah.
But, they just learned, and they'd get a cold and they'd cry, I can't breathe through my nose. And I'd say, don't worry about it. Just breathe through your mouth every now and again. It won't kill you.
The physical, kind of barriers to nasal breathing can sometimes be, and especially in children with oral restrictions. You mentioned working on the muscles at the floor of the mouth, and also cranial release. Do you find these things help because some kids obviously aren't in the space for a release, and obviously exercises are very important with a myofunctional therapist. What are some of the things you would have parents just be mindful of in terms of, how this affects a child's breathing?
Yeah, there's children who are mouth breathers, and they're straining for air, so their head is forward, to open the airway and so on. They get very tight around the base of the neck, and you touch them, and they go, ow, 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 So massage your children, massage the base of their neck, get them used to a bit of massage. Do a bit of massage here, drain the lymphatics, work on their faces yourself. I think, simple things like that, I'll often train parents. Like I say, here we go. We're going to do a massage technique for the lymphatics and get the tension from the base of the neck. That kind of thing can be really great. Just pressing on the rib cage, lifting the rib cage, putting your hands on their belly, getting them to breathe into their belly. I'm assuming that we're talking, because the questions have been sort of seem like they're coming from parents. So I'm kind of directing my answers to them. In terms of health professionals, doing cranial release, I think I'm all about self-help. And it's good to do it with the guidance of a practitioner, but, really the work you do yourself is often has the biggest impact because you can do more of it, So that kind of thing is good. So cranial release, I think, I think I'm going to say something a bit controversial here. I'm a cranial osteopath as well as a structural osteopath, and I still do hands-on work all the time. And I reckon cranial work and manual therapy is a waste of time if you don't close your mouth, breathe through your nose, and learn how to breathe properly. Because whatever your therapist is doing, if you're not taking care of that, you're going to end up in the same place. So
that's what I'm seeing, because we make a dental diagnosis of this, and we try and integrate these kind of things into the interface. But the thing I constantly see patients report is that they go to their body worker and it works for a couple of weeks to months at best, and you can see the oral posture that they're stuck in. And what you're describing is they're not changing the function. It's like, well, you have to change how you use the system for it to stay like that. It's so I think that makes complete sense.
Yeah, that's the big message. And I just sort of keep saying that. I do a bit of teaching at Southern Cross Uni, and I also mentor research students doing their research masters. And I'm always plugging away, function. Think about, because osteopathy is about the interaction between structure and function. And I was saying function. And they're going, but that's not osteopathy. Like we want to do our manual therapy. And I go, yeah, but you want to get results, right? You want your patients to get better. So don't just make them rely on your manual therapy. Get them to do things. Get them involved. Then you'll really see the results. And that's fantastic for everybody. Because as a therapist, you live for your patients getting better. That's what keeps you going to work. And so you want results. No practitioner wants to endlessly be treating a patient who doesn't ever get better, unless that's your business model. But honestly,
no, I think it's
a soul destroyer. Yeah,
absolutely, and it really is describing a health modality that is much more multifaceted than just one. Going to one practitioner and having something fixed. Something like this really isn't going to go away from just one problem, but there are many different contributors. Rosalba, how would you recommend for people? There are many people listening here in the US. How would you recommend them finding a breathing therapist, or some tips on that?
There are people around. Some orofacial myofunctional therapists do breathing work. I've been, in the last few years, starting to train people in the integrative breathing therapy approach. And so, if you want to get a bit more information, you can come to my website. I'm doing a lot of online stuff these days, including group work. And, eventually what I hope to do is to have a nice list of people who I can refer to. At the moment, breathing, the quality of breathing therapists varies enormously. It's a really new developing area. But what you want, I mean, a really good place to start is an airway focused, dentist. They'll often have good connections. And looking for breathing therapists, I think it's a little bit difficult, but you just try the internet. Sorry, that wasn't a very good answer, was it, Steve? It's because it's a new developing area, and
we can
honestly,
direct them.
yeah.
Well, it's a difficult area. You're right, and I get a lot of inquiries for recommendations, and it is very difficult. So, I mean, look, having that perspective is important. We'll give them your website at the end so that they can look up to see if they can join your online trainings and also find a practitioner you've trained.
Yeah.
Rosalba,
Can I just say, I've been doing an online training for practitioners, which is a integrative breathing therapy, nasal upper airway focus, and I'm doing one in November in US time, and I'm doing that with Dr. Barry Raphael. Do you know him?
Yeah, absolutely.
Yeah,
Barry's
yeah.
great.
He's sponsoring a US time-based course, which is going to be for me over 2 mornings, and in the US over 2 evenings, where I do a lot of the nasal rehabilitation, upper airway, like integrative upper airway training, which is looking at how the nose and the upper airway, they integrate with the whole breathing system. So, that's a training. And I did one earlier in the year, and there are a number of people in the US who did that. And so, but I didn't, if people email, I can might be able to direct them. There's also, I've got a website of people who've done a Facebook group of people who've done my training, and I can always flick requests through to that, and people can respond who are in your area.
Yeah, and there's, as you mentioned too, that there is practice out there that has been happening in human culture for a long time as well. It is a little bit varied. I was interested. It was a few years back. I was reading. It's in the Vedic text, isn't it, where they talk about the breathing cycles and the counts of the breath, which I found really interesting. The 4-second count. Just before we finish up, what was your in reading some of those very ancient therapies? What you thought about, and also to the philosophy of breath too. It's just fascinating what they thought about the essence of life, and something that we are, someone like yourself has really connected into science and to what's physiologically happening in our bodies. This is something that is something very old and very fundamental that is we're starting to understand at a very much broader level now.
Yeah, absolutely. So the counting of the breath, you've got specific different counts in yoga and pranayama. Yeah, they use a lot of counts. And it's interesting. When I was I went to a conference in Bangalore just of yogis, pranayama people. It was a research conference in 2002, I think. And there were a bunch of people there who were, gurus, and they were all convinced that their count was the perfect count, 4 4 6 2 4 9 3 8 4 7 8, whatever. And so it's interesting. Like I kind of came to the conclusion, look, it's just the process of counting, that focuses the mind. That's really good. But there are specific counts of breathing that help to organize neural rhythms optimally. They all do. All types of breathing techniques will tend to take you out of default mode in the brain, and it'll tend to improve the functional connectivity of important parts of the brain that regulate the stress response, like the amygdala and the prefrontal cortex. It'll improve those connections, plus other areas. So anyway, breathing for a 10-second cycle, getting your breaths into a 10-second cycle has this optimal effect on the brain and on the autonomic nervous system and on the baroreflex, blood pressure system in the body, and on heart rate variability. So slowing the breath right down, to about 5 to 6 breaths per minute really organizes all these different rhythms and oscillations in the body. So, but don't get addicted to that, because I think that The real strength of breathing therapy is actually working with a variety of rhythms. And so it turns out the yogis might have been right. That's where I'm coming to, working with a bunch of different patterns and rhythms. But then knowing that there is this sort of real sweet spot, which is breathing at about, 10-second cycle of breath.
Yeah, I found myself that focusing on, because I've always found that meditative practice are quite difficult, switching off the monkey brain. But that count of breathing does help to kind of remove you from those kind of everyday thoughts. And the physiology is all there, isn't it? But it does all kind of, for most people, they have to slow down, don't they? And
most people have to slow down, but sometimes speeding up is good too. Do you know? One thing that one of the big things for me, revelatory moment, was that at first when I was working with the Buteyko method, it was all like, reduce your breathing, breathe less, reduce your breathing, regular, even, reduce breathing. And it's like, that's not life. Do you know? Life functionality means variability, responsiveness, and you want different things going on. And the same with the breath. So a lot of people with bad anxiety and a lot of the dysfunctional breathers, they know about controlling the breath, and they do something which is bad for them without knowing it. They over control the breath. So this all gets into the subtlety of breathing therapy. Some people need to control more, some people need to control less. Some people are very chaotic and irregular. They need more regularity. And some people are just dysfunctionally regular. And so you need to, work with that.
I think that's great. Obviously, everyone's different, and you see this in people's personalities as well. For people that are very controlling and very kind of want to have everything in their life, including their health, under their control. Sometimes I'm always trying to just give them a little bit of guidance. That maybe you need to relax in this sense, and maybe that will kind of get you where you need to be. Which kind of comes into breathing, doesn't it?
Yeah, it sure does. And it's about connecting the mind too. Like I always say to people, breathing is a brain exercise and it's a mind-body practice, So using breath to relax is not just about slowing the breath down to a particular rate or reducing the breath so much so that you raise CO2. It's really about working with that breath-mind-body connection. Can I just mention too, Steve, that one of the online courses that I've got coming up is an online breath-mind-body course, which is over 5 weeks.
Excellent. Yeah. Actually, why don't you, where can people find you with your website and your courses so that they can look further?
Well, my website's just rosalbacourtney.com. And there's patient and practitioner courses on there. So.
There. And you'll be doing some online training coming up.
Yeah, I've got some online practitioner training coming up in November. But the patient programs, I've got a Healthy Breathing, Healthy Child online program, it's limited, very limited numbers. I can only work with very small groups of children. It's only like 4 or 5 kids. And people have to have a consult with me first because I do an evaluation first. So that's a bit limited. But the breath, mind, body don't have to do an evaluation. It's just working with breathing, mindfulness, different rhythms and patterns of breathing, learning to use the breath in daily life for stress reduction. And that's kind of, you don't have to have a consult first.
No, it's great. And there's all different tools that work for different people. Rosalba, I just want to thank you so much for, devoting so much energy and your life to such a fundamental human practice, and to something that I completely agree with. This is something that really controls a very fundamental aspect of what makes us, our mind. And, I think people can really have, huge benefits from, taking in some of your wisdom as to how to breathe better. Rosalba, thank you so much for joining me today. I hope to meet up with you soon, and we'll have to do some, update on all of this. There's been so much discussion on breathing. It's great.
Yeah, it's getting popular. People don't think I'm crazy anymore. Are you obsessed with breathing? I go, if you only knew. It's everything.
All right, Rosalba. Well, thank you so much, and we'll have a great day. We'll see you soon.
Okie dokie. Thank you, Steve.